Therapist Learning Center, guide and documentation of daily visit notes. Daily visit notes must include 1. Time in and time out. 2. Subjective evaluation and observation. 3. Training exercises and treatment given. 4. Teaching and home exercise program, HEP training. Statements that demonstrates. 5. The progress of goals. 6. The need for continuing therapy. 7. Co-founding factors that delay progress. 8. The plan of treatment for the next session. Although there are some necessary parts of the visit note form that need to be filled out that's not included in this list, mastering the 8 must-have will help your reader picture out if there is a medical necessity and what kind of treatment was given to the patient. This will save you a lot of time and/or protect you during insurance billing questions and unexpected patient care litigation. Please take the time to learn this training. I will recommend you listen to this training and repeat until you've mastered it. Time in, time out. A suggested time for at least 55 minutes up to 60 minutes, assuming the patient can tolerate the therapy and is medically necessary. Please take note if the patient was seen in the afternoon to enter the time in military format. Example for 1 p.m. to 2 p.m., please enter 1300 to 1400. 2. Subjective evaluation observations. This is a part wherein a patient, patient's family member, or other health care team professional reports their evaluation or observation since the last patient's visit. These are more relevant when they relate to their goal. Example, a child with difficulty in bedrolling. Correct, per mother, the patient was able to turn from supine to side without help today. Wrong, mother is in a good mood today. The patient sleeps in bed upon PT arrival. 3. Training exercises. Treatment given. The treatment given must follow the treatment plan and goals stated from the evaluation. The payer will not pay the treatment if it does not follow the stated treatment plan. The documentation must give the reader, who has not seen the patient at all, a complete picture of what happened during the therapy session. A. CPT description. What type of therapy given? Example, therapeutic exercises. B. Assistance given. Amount of assistance given by the therapist. Example, minimal assistance. C. Patient participation. The amount and quality of patient's participation. Example, patient able to extend the neck occasionally when given tactical stimulation on her upper back, MS. D. Spent time. How long was the particular treatment done by the patient? Example, 15 minutes. List of CPT description can be found at Theramax Orientation Form, Therapist Orientation Guide. To help everybody remember the content of good treatment documentation, we want you to remember the word CAPS, CAPS, stands for CPT description. Assistance is given. Patient's participation, spent time. A case example. A case of an 18-month-old patient with 3 months developmental milestone age. Patient able to maintain prone position but failed to raise head up. Discipline, physical therapy. C. Therapeutic exercises. Neck extension strengthening. Prom exercise neck extension. Prone to PT lap. A. Minimal assist across patient chest to stabilize the patient position. Placement of a favorite toy in front of patient face to encourage lifting of the head. P. Patient minimal neck extension participation noticed on the terminal part of the motion. S. 10 reps times 2 sets, total time of 15 minutes. Neuromuscular reeducation. AAROM exercise to back and neck extension. Starting position prone to therapist lap. Palms of B. Hands position flat on the mat for support and to encourage weight bearing. Leg semi-resting on the mat. A. Tactical cueing of stroking and deep pressure applied to the paravertebral muscle area and visual cueing by placing patient favorite toy in front of the patient face to encourage neck and back extension. P. Patient occasionally able to push self up to back extension. S. Total time 15 minutes. 4. Teaching home exercise program HEP training. Your training documentation must answer these questions. 1. To whom the HEP is taught. 2. What HEP training given. 3. How does the trained person respond to the training? An example: verbal instruction and demo to the mother of the child, MOC, on how to perform safe gait training with her son using an RW of at least 20 feet as tolerated per day. MOC verbalized understanding and return demo performed. 5 to 7 statements that demonstrates A. Progress to goals, B. The need for continuing therapy, and C. Co-founding factors that delay progress. 5. Progress to goals indicated by: correct, patient able to show minimal neck extension movement in prone with facilitation technique. Wrong, you just leave it blank. 6. A statement that demonstrates the need for continuing therapy. Correct, needs continued skilled therapy to address delayed motor developmental issues as stated in the evaluation goals, inability to perform back and neck extension. Wrong, per PT plan of care, POC, or just leave the space blank. 7. Statements that demonstrate co-founding factors that delay progress. Examples: a MOC verbalized her child being sleepy most of the time in the past few days, thereby unable to perform HEP and less active compared to the past few weeks. B. A child has less tolerance to therapy. Patient cries a lot despite of mother intervention. 8. Statements that describe the plan of treatment on the next session, intervention, and objective. Correct. We'll continue to work on the child back MS weakness by performing activities that encourage back extension. Wrong. Continue with PT, POC per goals. This next part of the training will guide you on how to fill out the Kinsner OT and PT daily visit notes. Green highlighted areas are auto-populated information, so you don't have to input anything during your documentation. Yellow highlighted areas are the areas to be filled for both geriatric and pediatric patients. Blue highlighted areas are for the geriatric patient only. The vital signs may be warranted for pediatric patients. Use your best judgment. You may skip the transfer training section up until fall risk testing section of the form and document all your treatment interventions in training exercise section. You have successfully finished the tutorial. This tutorial was created by Marketing and Quality Assurance Department. Visit us online at www.theramaxtherapyservices.com. Call 713-244-9505 for questions regarding your orientation or more information about our therapy services.